All right, I'm going to be doing Tristan's neurological exam today. We're going to be starting with the second cranial nerve, which is the optic nerve. I'm going to ask Tristan to close one eye, and I'm going to have him read this line right here.
F-E-L-O-P-Z-D.
Perfect, and just opposite eye and do the exact same thing.
F-E-L-O-P-Z-D.
Perfect. Usually with the Snellen test is usually 10 feet away, but unfortunately just due to the circumstances, it is not, and it's usually 20/20 vision. I'm going to ask Tristan to close one of his eyes, and I'm going to mimic the same eye, and I'm going to ask Tristan to tell me when he sees my fingers wiggling.
Yes. 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 Yes.
Awesome, and then I'm doing the same thing with the opposite eye. Switch.
Yes. 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 Yes.
When I see my fingers wiggling, Tristan should be seeing his fingers wiggling too, and everything seems nice and normal in all 4 quadrants. Now I'm going to be doing the ocular motor nerve, which is number 3. We usually assess 2 and 3 at the same time. So I'm going to be looking at Tristan's eyes and shining a light in his eyes. I'm going to be looking for pupillary constriction. I'm going to be looking for the size and the shape of Tristan's eyes, which they're both equal, round, and reactive to light, going from a 3 to a 2 with constriction. I'm going to also look at Tristan's eye, and I'm going to be looking at the opposite eye that I'm shining the light in, and I should be looking for pupillary constriction as well, which I do. I'm going to be asking Tristan to cover one eye, and I'm going to ask him to follow my pen all the way closer, and I should be seeing pupillary constriction as well, which I do too. Awesome. Now I'm going to be assessing cranial nerves 3, 4, and 6, which is 3 the ocular motor, 4 is the trochlear, and the 6 is the abducens. Follow my finger, please, up and down. And while I'm doing this, I should be looking for any nystagmus. I'm going to be going in and be looking for any convergence at all, which is the eyes crossing inwards, which there is. And I'm going to be looking at Tristan's face, and everything looks nice, even symmetric, and there is no ptosis in the eyelids at all or anything like that. Now I'm going to be doing cranial nerve 5, which is the trigeminal nerve. I'm going to be palpating Tristan's masseter muscle here, and I'm going to have him open and close his mouth. Now clench his jaw nice and hard. Beautiful. Now go side to side with your jaw. I should be feeling for equal strength throughout, and which everything seems nice and symmetric there. Now I'm going to be asking Tristan to close his eyes, and I'm going to be hitting 3 spots on his face, asking if it is soft or sharp.
Soft. 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 Sharp. Sharp. Sharp.
Perfect. Now turn to the other side for me, please.
Soft. 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 Sharp. Sharp. Sharp.
Perfect. Everything looks great there. Now I'm going to be doing cranial nerve 7, which is his facial nerve. I'm going to be asking Tristan to smile, frown, and then can you stick out, let me see your top and bottom teeth at the same time. Perfect. Puff out your cheeks. Perfect. Now raise your eyebrows. Amazing. And now close your eyes. And now don't let me open your eyes while you try to open them. Beautiful. Everything looks nice, strong, and symmetric throughout. Now I'm going to be doing cranial nerve 8, which is the vestibulocochlear. Can you turn around for me? I'm going to whisper a word into Tristan, the opposite ear that Tristan's covering.
8.
Perfect. Now to the other side.
Apple.
Perfect. I should be around 3 feet away when I'm doing this, and any word that I say, Tristan should be able to repeat at that whisper tone. Now I'm going to be doing cranial nerves 9 and 10, which is the glossopharyngeal as well as the vagus nerve. I'm going to be asking Tristan to open his mouth for me and say, ah. I'm going to be looking at with a light in his mouth as well, and I should be seeing that his uvula is equal and symmetric, and that his palate and his pharynx are, when he says ah, they constrict medially together and at equal strength, which they do. Now I'm going to be looking for doing the 11th cranial nerve, which is the spinal accessory, and I'm asking Tristan to lift up his shoulders. Perfect. And I should be looking for any atrophy or fasciculations at all in his shoulders, which I don't. I'm going to ask Tristan to push against my hand. Beautiful. And the same thing on this side. Beautiful. At equal strength. And everything feels nice and strong and equal, and there's no atrophy or fasciculations at all. Cranial nerve 12 is the hypoglossal. I'm going to ask him to open his mouth and stick out his tongue. And I'm going to have him move it side to side. Beautiful. Now the other way, up and down. As I look at that, I'm going to be looking at any atrophy in his tongue or any fasciculations there, as well as if there's any tongue deviation at all. There is not. Everything looks nice and symmetrical.